Okay, today we're going to discuss respiratory disorders, and we'll go through several different type of disorders based on if they're caused by an infection or if they're due to environmental factors or if cystic fibrosis is a genetic disorder. So we'll talk a little bit about that. Pneumonia is an infection of the lung, and it is caused by bacteria most commonly. However, it can be caused by other things as well, viruses, fungi, parasites, and this infection leads to an inflammation of the lung. Symptoms of pneumonia include fever, chills, cough, rapid breathing, and wheezing and grunting sounds. It is usually treated with antibiotics because it is most commonly caused by bacteria. However, it can be treated with other medication depending on the cause. So here is a photo of lung tissue, and in this top picture you can see these are the alveolar sacs, and they are nice and clear of mucus and buildup. And then down here in this bottom picture, this is an infected lung. So all of these little alveolar sacs that make up the lung tissue have a lot of mucus buildup and all of that because of the bacteria. Bronchitis is a viral infection, and it causes the bronchioles to swell, and it also causes formation of mucus, and both of these make it more difficult to breathe. Symptoms include wheezing because of that swelling of the bronchioles. It constricts the airways, and also coughing up a lot of that mucus. It's treated with asthma medications mostly, and that helps to reduce the swelling and make it a little bit easier to breathe. So here you can see the picture on the right is from bronchitis, and you can see how this the bronchiole has really thickened up here due to swelling, much more than a normal bronchi. And you can also see a lot of this mucus that's formed here in the bronchiole. And both of those make it a lot harder for air to pass through these. And that's what leads to the kind of the wheezing sounds. Emphysema is a chronic lung disease, and it causes damage to the alveoli. So this is irreversible damage, and smoking is the main cause. It can be caused by other environmental factors as well. Symptoms include shortness of breath and wheezing and also fatigue. And like I said, this is irreversible damage, so there's no cure. However, the symptoms can be managed with supplemental oxygen and other medication. So here's a little photo of emphysema, and this bottom picture, these are normal alveolar sacs. So they're nice and full. You can see they take up all this, the tissue fills up all of the space of the sac. And however, on the top here, you can see these are alveolar sacs of someone with emphysema. So each one of these, where it used to be nice and full of that healthy tissue, they've basically collapsed. So no oxygen transport or anything can take place in this tissue. So that's what leads to the difficulty breathing and the other symptoms. Asthma is a chronic respiratory disease as well, and it causes airway inflammation. And this is where the airways in the lungs are overly sensitive to certain triggers. So these can be allergies, it can be other things in the environment, and it can also be just hereditary. Symptoms of asthma include wheezing attacks, coughing, chest constriction because of that inflammation of the airways, and that leads to labored breathing. Inhalers are usually used to treat asthma. It can be steroids or other anti-inflammatory drugs. Those help with the inflammation to kind of decrease that inflammation, making it easier to breathe. Tuberculosis is a bacterial infection as well. And this bacteria actually attack the lung tissue. And this leads to inflammation of that tissue, and it can also lead to damage of the tissue. Tuberculosis is spread through the air, so coughing which is a main symptom, can actually spread the disease. Most infections are classified as either latent or active. The majority of cases are latent. This means that the bacteria is actually inactive and it's not causing any symptoms. So in a latent infection, the white blood cells actually go to the lung, and they kind of form little bitty encapsules around the bacteria. And that kind of keeps the bacteria from causing any symptoms to occur. Only a few of these latent cases actually progress to active infections, and that's usually in immunocompromised patients. So in patients that have some other kind of underlying condition that just make them more susceptible to bacterial infections. And if these active infections are left untreated, then about half of those cases, the patient will die. So symptoms of tuberculosis: bad cough, usually coughing up blood, weight loss, fever, fatigue, chills, and also just general pain in the chest. It's not very common in the United States anymore, and however, in other parts of the world it is still fairly common, such as Asia and parts of Africa. And the treatment is pretty complex, so it usually involves about several months of antibiotics in order to get rid of the bacteria from the lungs. So here's a little picture, and all of these little yellow spots are actually white blood cells. And each of those white blood cells are basically holding bacteria inside of it. So they're forming little capsules around the bacteria. And that's called granulomas. So if you took a chest x-ray of this person, then you would see how all these little granulomas would show up on the x-ray. So this is those white cells are what's keeping the infection latent. It's kind of encapsulating that bacteria and keeping it from being able to reproduce so much. However, that's also what causes a lot of the lung damage, are these white cells, because while they're trying to do their job, it's also, these little granulomas can also cause tissue damage. Cystic fibrosis is a hereditary recessive disorder. Recessive means that in order for someone to have cystic fibrosis, both of their parents must be a carrier of the defective gene. And this defective gene affects chloride transport in and out of cells. So in the like the bronchioles and the lung tissue, all of those cells, chloride cannot be transported out of the cell. So if you think back to osmosis, water follows chloride. So if chloride is stuck in the cells, that means the water is also stuck in the cells. And how if you and me, if we kind of have a little congestion, cough a little bit, we can usually cough up that mucus fairly easily because it's a lot of water. However, in someone with cystic fibrosis, that mucus is really dried out and it basically just sits there. And it doesn't matter how much they cough, it's really difficult to kind of cough it up. So in the lungs, this can lead to more infections because that mucus just kind of sits there. It's hard to clear out any bacteria that we may inhale or we might be exposed to. In the pancreas, it can prevent digestive enzymes from reaching the intestines. And this can lead to decreased nutrient absorption. In a second, I'll kind of show you a picture with that. Treatment of cystic fibrosis, there's no cure because it is a hereditary, a gene defect. So there's no way to cure, but they can be given antibiotics to help prevent infection in the lungs because that mucus, because they can't clear out all the bacteria or anything because of the dried out mucus. They can also do exercises to help remove mucus from lungs. And let's see, there's digestive enzymes can be mixed into foods and vitamins, extra vitamins, since they're not going to be able to absorb quite as much as a normal healthy person. So here is the pancreatic duct. Sorry, that pen is a little. Let's do it back. So here's the pancreatic duct, and right here is where all those pancreatic juices are being kind of flow into the intestine to help with digestion and everything. So if this duct gets all blocked up, then all of those juices are not going to be able to reach the intestine to help with breakdown, and so nutrients can be absorbed. Let's see. I also have a little link here, cystic fibrosis. This is the Cystic Fibrosis Foundation page. There's lots of information on here, just in general, what are some symptoms, and there's also some videos of people that live with cystic fibrosis, and kind of you can see a little bit of their everyday life and how they can be the routines that they have to get into to help deal with this mucus that just builds up in their lungs. So, in summary, there are many different causes of lung disease. Bacteria is the most common when you think about infections with pneumonia and tuberculosis, and then viral infections are the leading cause of bronchitis. And then there's can be environmental factors that can also affect the lungs. So asthma can be, it can either be hereditary or it can be brought on by allergic triggers in the environment. And emphysema, the main cause is smoking. So a really good way to prevent emphysema is just to not smoke. And there are other different treatments depending on the cause of the lung disease. So antibiotics, inhalers, breathing treatments, additional vitamins in the case of cystic fibrosis. So I think that is it.